The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Good afternoon. Thank you for joining us. This is the Department of Family and Support Services Health Promotion Services RFP webinar. We will do introductions in a couple slides, but just to let you know about this RFP, the release date was August 27th, and the due date is September 21st at 12 p.m. Just some housekeeping rules before we dive in. Due to the volume of participants, everyone has been placed on mute. Please submit questions via the question box, and we will respond to questions after going through the slides. Please use the question box to notify us of any technical issues. Julia is with us. Julia, there's a pop-up screen. Looks like maybe your Outlook that we're seeing.
Yes, because I just realized that we are presenting.
Yes, I think I thought that too, and I was going to go one more slide, and then I was like, I don't know if this is right.
I'm so sorry. We have another RFP out for health promotion. That RFP, that webinar is going to be on September 7th, and I have very nicely put the wrong PowerPoint up for us. So let me just switch that out. So we're going to be doing comprehensive fitness today. I hope that that is what you were hoping to attend. Let me do comprehensive fitness. Let me close out of the other. Here we go. Here's our comprehensive fitness RFP. Let me make sure that I'm showing you the right screen. This is so many things. What do you just see a
Just a blue screen right now. Oh,
screen? There we go. Perfect.
There we go.
About that delay. Here we are. The webinar has begun.
Sorry about that, everyone. so many RFPs. The release date was August 24th. The due date is September 21st at 12 p.m.
So, everybody has been placed on hold. Please submit your questions via the question box, and we will respond to the questions after going through all the slides, and use the question box to notify us of any technical issues you might be having. There we go. You can see I'm new to looking. Here is, you want to go through the agenda?
Sure. This is the agenda. Welcome again. We'll do introductions on the next slide. We'll talk about the purpose of the RFP, the background, the scope, the program description, selection criteria, timeline, some technical assistance, and some questions at the end. So unfortunately, Yolanda Curry, our Deputy Commissioner for Senior Services, is not able to be with us today. So I am filling in for her. I'm going to do my best to fill in for her. My name is Sean Dolan. I'm a Regional Director with the Department of Family and Support Services. And I'll be talking about the programmatic side of the RFP. And also with us is Julia Talbot. She's a Senior Policy Analyst with the Department of Family and Support Services.
I will be talking about how to go through the technical aspects of making an application using the City of Chicago's EProcurement system.
So the purpose of this RFP, the Comprehensive Fitness Program, we are seeking to procure a delegate agency to provide fitness services to older adults age 55 and older at our network of 21 citywide senior centers, consisting of 6 regional senior centers and 15 satellite senior centers and 19 community site locations, in addition to online and telephonic program offerings. Next slide. So for the background, we are the local area agency on aging, and our division coordinates and funds services for older adults, prioritizing those in greatest economic and social need, those who live alone, and those at risk for institutional placement. So working with our partners, our division's efforts are guided by supporting older persons to live independently in their own communities and homes for as long as possible, ensuring that those who reside in institutions are treated with dignity and care, and lastly, guaranteeing that older persons have access to accurate information to participate in public policy. So together with our service providers, we've actually been providing comprehensive fitness services to older adults since 1995. Funded by Title 3B and Title 3D of the Older Americans Act, the OAA, in addition to State of Illinois General Revenue Funds and Community Development Block Grants, CDBG. These services have been designed to empower older adults in remaining healthy and safe within their homes via online and telephonic programming, and communities via programming at neighborhood senior centers and community site locations. And then such services then align with our division level goal of supporting older adults to live independently for as long as possible. We can go to the next one. So the goals of this program are to assist older adults to increase their fitness and health awareness, increase their self-determination in managing their health, and increase positive health behaviors. Next slide. So this slide sort of talks about where we're at and where we are hoping to go. In fiscal year 2019, 9,041 unduplicated older adults participated in our fitness services, and 16,431 units of service, which is one activity session or 1 hour of related service provision were performed. In fiscal year 2020, amidst the COVID-19 pandemic, our numbers dropped a little bit. 6,645 unduplicated older adults participated in fitness services, that is in person, over the phone, and online. It's 11,076 units of service performed. With that, we are hoping that the selected respondent can help us and assist us with outreach efforts to continually increase the number of older adults who are using our fitness services. Looking forward and trying to improve with our efforts. As a result of the COVID-19 pandemic, the comprehensive fitness program seeks to further expand by increasing social isolation programming, such as making well-being calls to participants or implementing other innovative initiatives, but also by increasing online and telephonic activities to complement our traditional in-person services that are all at our senior centers and at our community sites. Next slide. Our target population, community-based older adults, age 55 and older. There's also some prioritized subpopulations. Older adults living in medically underserved areas, older adults demonstrating greatest economic need, with particular attention to low-income minority individuals, older adults at risk for institutional placement. And some additional special populations for this RFP are older adults with limited English proficiency and older adults with disabilities. So getting into the program requirements, the slide is just sort of giving an overview of the program requirements. We will be selecting one respondent to provide fitness services via online and over-the-phone platforms and in person at our 21 City of Chicago Senior Center locations and our 19 community site locations. So there's a grand total of 40 locations where these services will be performed. The selected respondent will be responsible for overall program management, and that includes assisting with outreach efforts, as we noted before, developing a screening assessment for all participants or utilizing our program's current one, incorporating best practice and evidence-based standards, delivering the program's core services, which we'll talk about in a second, utilizing certified fitness instructors and professionals, and then lastly, evaluating and reporting client satisfaction. That's just sort of a brief overview, but we'll dive into some more specific requirements. Next slide. So the core services, there's 3 core services. The first one is group exercise classes. This entails administering daily, weekly, weekday exercise classes, including instructions in the areas of range of motion activity, stretching, strength and resistance training, aerobic exercise, and balance / coordination at all 40 senior center and community site locations, in addition to online and over the phone. Delivering one or more ACL, approved highest tier evidence-based exercise programs as demand dictates at all 40 sites, in addition to online and over the phone, and then offering additional specialized classes as demand dictates. And then our second core service is one-on-one personal training. One-on-one personal training entails administering screening assessments, designing appropriate exercise prescriptions, and orientating participants to fitness equipment at all 21 senior centers. This does not include the 19 community site locations, please note, as those locations do not have fitness equipment. So it's just at the 21 senior centers. In addition to that, it's also required to monitor the use of the fitness equipment at all the 21 senior centers on a daily, weekday basis and as demand dictates to ensure proper usage and safety. And then lastly, this is a new component, social isolation and recreational programming, providing ongoing social isolation programming, for example, fitness programs or virtual programming or well-being calls, like we mentioned before, and other innovative initiatives at all program sites or online or over the phone to address isolation and loneliness among targeted older adult populations. And those targeted older adult populations may include individuals with limited English proficiency, LGBTQ elders, minorities, and individuals with chronic illnesses. We can go to the next slide. So a unit of service. 1 unit of service equals 1 activity session. That is a group exercise class or a one-on-one personal training session or 1 hour of related service provision. That is a screening assessment or a fitness monitoring. The selected respondent is authorized to propose a per hour unit rate for the services offered as described in this RFP. And please note that travel, paperwork, planning, and administrative duties will be included in the unit rate reimbursement. Next slide. So due to COVID-19, emergency contingencies are super imperative at this point in time. Because of that, special emphasis should really be placed on developing plans for any emergencies, pandemics, winter storms, tornadoes, heat waves, etc., that require a change in program. For this specific RFP in this program, all fitness services are to be moved to online or over the phone platforms in case of an emergency or shelter-in-place order. So staffing qualifications and requirements. So the selected respondent is required to assign and maintain for the duration of the services a staff of competent personnel that is fully certified or licensed, equipped, competent, and qualified to perform the services. The program director or coordinator mainly is in charge of overall general management of the program. Specifically, they're responsible for program operations, overall service delivery, supervising the certified fitness instructors or professionals, ensuring an adequate number of staff are employed, making sure there's a backup plan in the event of staff absences, providing a wellness program, schedule for marketing publications, and assisting with special events. Please note that this position, Please note that this position may not be vacant at any time during the contract period. And then with regards to the fitness instructors and professionals, they are responsible for implementing the core services that we talked about in the previous slide: group exercise classes, the one-on-one personal training, and the social isolation program. So the coordinator is coordinating it all, and the fitness instructors are really implementing it. There is a minimum of one fitness instructor or professional required at each program location, and those professionals must possess at least one of the indicated certifications in the RFP. They must meet all training requirements in the RFP and comply with all applicable laws relating to background checks, fingerprinting, and screening procedures. So program requirements with regards to client contributions. The selected respondent may not, please note that they may not charge for any of the program services. Due to the OAA, all participants must be provided the opportunity to contribute or donate to the cost of their services. The contributions, though, please note, are strictly voluntary. Therefore, we can't enforce a charge. But the selected respondent must have a process to collect and record, reconcile, and report these contributions received on a monthly basis back to us at DFSS. And all collected income must be used to expand the services of the provider and supplement, not supplant, funds received for the program. In addition, the amount of client contributions collected on a monthly basis must be deducted from the monthly invoice that's submitted to DFSS, and all project income must be expended within the fiscal year in which it was earned. So the goals and outcomes of this program. We're particularly interested in seeking out respondents with evidence of strong past performance against desired outcome goals. We will monitor through the selected respondents created client satisfaction survey a set of performance indicators that may include but are not limited to the following. The hope is that 75% of participants will increase their fitness / health awareness. We're also hoping that 75% of participants will increase their self-determination in managing their health. And lastly, we're hoping that 75% of participants will increase their positive health behaviors. In addition to that, we're also hoping to track output metrics that may include but are not limited to the number of participants satisfied with the overall program service delivery by the selected respondent, the number of unduplicated program participants, the number of new participants to the program, and the overall number of service hours performed. So with regards to contract management and data reporting requirements, obviously, the selected respondent's responsibility to keep track of participant files. That includes intake forms and assessments, the medical release forms and ongoing documents. That is the assessments, service records, progress notes, and service plans. Selected respondent is also in charge of overseeing their own instructor files, including participant program evaluations, attendance forms, program manual, invoices and supporting documentation, written correspondence to and from DFSS, and the resumes and certifications of the fitness instructors and professionals. Selected respondent will also be in charge of overseeing the grievance process and the client satisfaction surveys that we just talked about with regard to the performance goals and outcomes. The respondent must supply all clients with a mechanism for filing complaints or grievances with regards to the provider service delivery. And the selected respondent must also have procedures for evaluating and reporting the client's satisfaction with the program's delivery and outcome. In addition, there's also monthly reports, as indicated in RFP, that must be submitted in a format specified by DFSS and by established deadlines. And then lastly, there's monthly mandatory meetings to be held with the selected respondent to discuss program operations and to track overall progress. Next slide. So the term of this contract will be from October 1st of this year until September 30th of 2023. Based upon need and the availability of funding and contractor performance, DFSS may extend this term for up to 1 year after 2023. This contract will operate on a reimbursement basis only, and no advances will be given. And just one delegate agency will be awarded based upon the continued availability of funding levels up to $600,025 annually. Also, please note that the respondent will be required to complete a cost proposal worksheet, providing an estimated annual service volume for each of the program's core services, which were, if I can recall, the group exercise classes, the one-on-one personal training, and the social isolation program, and indicating their proposed unit rate for each of those 3 core services. So now we're going to talk the next couple slides about the criteria for selecting a respondent. The first one is the strength of your proposed program. So we're looking for a respondent that clearly defines fitness services to be provided, either directly or through partnerships or linkage agreements with other agencies that are appropriate to addressing the needs of and achieving desired outcomes for the older adult target population. The respondent's proposed service plan is supported by strong evidence-based programming that we talked about before, ACL approved, and aligns with best practices for the relevant field. The respondent also demonstrates a clear understanding of the older adult target population and all the special and subpopulations that we talked about before and their needs and challenges. The respondent has an effective approach to identifying and retaining program participants and solicits and incorporates client feedback into their program model. And lastly, the respondent demonstrates experience providing fitness services virtually, which is important due to the pandemic right now, and in person. Next slide. Performance management and outcomes. The respondent demonstrates evidence of strong past performance against desired outcome goals and performance metrics, which we sort of talked about a little bit before, and or other notable accomplishments in providing fitness services to the targeted population. The respondent has the relevant systems and processes needed to track and report performance on program outcomes. The respondent has experience using data to inform or improve its services or practices. The respondent has the relevant systems and processes needed to collect and store key participant and performance data. With regards to organizational capacity, the respondent has the qualified staff responsible for program oversight and management. That is the program coordinator position. The respondent also has adequate systems and processes to support monitoring program expenditures and fiscal controls. The respondent has adequate human resources capacity to hire and manage the staff, including the program director and the fitness professionals. The respondent has expertise working with the target population and has relevant capabilities and/or infrastructure needed to serve this older adult population. And the respondent's organization reflects and engages the diverse people of the community it serves. Slide. Reasonable cost, budget justification, and leverage of funds. It is hoped that the respondent has a fiscal capacity to implement the proposed program. The respondent leverages other funds and in-kind contributions to support total program and administrative costs. The respondent demonstrates reasonable implementation costs and funding requests relative to its financial and human resources, and the proposed budget supports the proposed scope of work or work plan. And lastly, the respondent demonstrates a process to track program expenditures and voucher in a timely manner. Selection criteria with regards to attachments. Please make sure to attach any reports, studies, or other documentation that show performance toward reaching the program goals and demonstrates results and accomplishments. Also, please make sure to attach job descriptions and resumes for not only the program coordinator, but also for the fitness instructor / professionals. Please make sure to attach your proposed participant screening assessment to be used when the participants come to use the fitness services, and a physician certification form. And lastly, please be sure to attach a cost proposal worksheet and your organization's budget for this program, making sure all program requirements are addressed. This is just the timeline with all the dates and times. Today we're having the webinar. The application though is due on Tuesday, September 21st at 12 o'clock. And then once again, the program will begin on October 1st. Just another friendly reminder, all applications are due on Tuesday, September 21st at 12 p.m. And at this point, Julie is going to talk about additional application tips and procedures.
Yes, thank you so much, Sean. That was lovely. So I'm Julia Talbot, and I'm going to help you talk to you today about how to do an application in the EProcurement system, which is the City of Chicago's online application, procurement application platform. I'm going to give you a couple of tips, and then we'll walk through some helpful, so a couple of different things that you'll need to do, accepting an amendment, and how to submit, that I think is helpful, especially for those of you who are not familiar with our system. So my first thing that I like to tell people is to start early. If you've not done business with the City of Chicago, you need to register into the iSupplier system, which gives you access to the EProcurement platform as soon as possible. To do that, you basically fill out a rather short form and send it to the Department of Procurement Services, and they will send you an email back that allows you to then set up your iSupplier account, that will allow you to access EProcurement. You can't make an application in the EProcurement environment without an iSupplier account. I'll talk to you about the resources. If you have questions about how to do that, you can reach out to me. There's a helpline, all sorts of stuff for you. In terms of just sort of like general advice about e-procurement, but also in terms of how to do your application. I highly, highly, highly recommend that you review the RFP document, which is included as an attachment in the application page in eProcurement. It's also available as part of the PDF of the RFP that you can get off of the eProcurement website for this RFP. I just like to tell people, to please review the application questions closely and understand that they align with the narrative, or the scope of the RFP, and with the selection criteria, which is also outlined in the RFP, and to use the information in the RFP for guidance in formulating your answers. Carefully review the selection criteria. Understand that we link all of these things together. They're not just random, questions. The narrative and the scope of the RFP align with the application questions. They all align or are represented in the selection criteria. And out of the selection criteria and the application comes our evaluative instruments. And so if you're looking for sort of insight about what we prioritize for a given answer or direction for a given answer, it's very helpful to look at those documents, because we will tell you, what we are interested in. So I know that they're sort of dense documents. Sometimes they're a little hard to read. They might not be the most interesting, scintillating, page turners that you've ever encountered, but they do have a lot of information, and that's the best, a really good place to sort of start your experience in developing your application packet to us. There's a 4,000 character limit, which includes punctuation and spaces. Each response is allotted for 4,000 characters. So 4,000 characters isn't your whole application. It's one question. One question gets the 4,000 characters. The eProcurement system is not going to tell you that you have exceeded that 4,000 character limit. So you really should build your application questions in a word processing document that can give you those counts. All eProcurement is going to do is sort of secretly cut off your answer mid-sentence if you exceed the 4,000 characters. But that is also as a caveat. Don't feel that your answers should 4,000 characters. I think that's like a single-spaced page, maybe more. You should be able to answer your questions. Don't feel obliged to use all 4,000 characters. If you do, that's great, but don't think that that's the absolute minimum. We don't count how many words. We're just counting sort of the content of your words. So just kind of keep that in the back of your head. eProcurement works best with the Internet Explorer browser, which no one, myself included, uses any longer. But if you are having any issues with the eProcurement platform and it's just glitchy or it's throwing you out a lot, there are not a ton of bugs left in the application process or the application part of eProcurement at this point. But I do find that sometimes your personal computer might not get along with eProcurement. If that's happening to you, put it in Internet Explorer and see if that makes anything better for you. I run eProcurement on my computer off of Chrome. I've done it Safari, Firefox, all of them, and it works well. But if you're just as a sort of as a first line, if you're having a lot of problems with eProcurement just not behaving for you, try it in Internet Explorer. The other thing I like to tell people is don't use the back button on your browser. When we get to other screens, most of the things that you need to go to are highlighted in blue, and that you can kind of click through stuff. You don't need to use that back button browser. If you do, what's going to happen is that it will it will continue doing stuff for you, but it's not going to save your work. You'll get it when you go to save. You'll get an error message that will throw you out. And when you go back in, none of the work that you saved after you hit that back browser button is going to be there. So try to remember. I've learned the hard way. Now, I've been burned many times. So just don't use it if you can. Just in terms of in terms of tips, we are very firm on our deadlines. I don't like to extend a deadline, and the only way we can accept a late application is to re-release the entire RFP and have everybody who applied the first time reapply. and I'm loath to do that as well, quite frankly. So understand September 21st at 12 o'clock p.m. It's a hard deadline. It's 12:01. If you're working on this thing 12:01, it will throw you out and it will suck away your application and you'll never see it again and it will not have been submitted. So I like to really emphasize to people to avoid the rush and possible mishaps by submitting early. Plan on your submissions taking 30 or 60 minutes. This is not a like click and buy kind of experience. And I'm going to go through the screens later on to tell you about that. Late applications are not going to be accepted. And then also, if you have problems, make use of I'm good for technical assistant. Sean can answer programmatic-based questions. The EProcurement hotline is 312-744-HELP. They operate 9 to 5, Monday through Friday, and they are there to help you. One other thing about the submissions is that if you're going to have problems, you really want to do this early, because if you need help, like, I'm always here on the day, the day an RFP is done. But if I'm talking to somebody else, I can't help you. And so you want to make sure that if you need help, that you can actually get it, which is why I really tell people to think about submitting early. Ideally, submit the day before. But, at least don't take it down to the wire. I've seen too many people miss being able to submit that way. And these are RFPs and applications are kind of a lift. Why work so hard to submit an application and just have it, you don't get it in because of the deadline? That's a bad feeling. In terms of technical assistance, under the DFSS webpage, there's a link of other RFPs we have out. As I previewed or foreshadowed, we do have a health promotion RFP out. The RFP webinar for that one is going to be next Tuesday from 11 to 12. Different link, but same fabulous interface, but same cast. It will really just be like a glorious part two. On the other hand, so if you want to see anything else in terms of what we have in RFPs, in questions concerning technical assistance, you can go to customer support or that helpline. You can also email or call me, and my name is all over. It's all over the web. Not the webinar. It's at the end of this PowerPoint presentation, but it's also in the RFP. It's you can Google my name. I've been in pretty much every RFP. It's very easy to get a hold of me. If you're a person that prefers to not speak to people and rather you like to watch videos or screenshots about e-procurement, you can go to the City of Chicago under this link, and we will be posting this webinar and the PowerPoint to the DFSS website shortly, in the next couple of days. So that will be up. You can access all of this stuff, and you don't have to talk to anybody. We have a lot of videos and a lot of sort of screenshot by screenshot kinds of instructions. So that's also there as a particular, as a resource to you. So I'm going to now go through the two most sort of common things that you might have to do in e-procurement besides build out your application. So we often, at the end of the webinar, we're going to have a question and answer. All of those questions and answers are going to be built into an amendment, which is then posted to the RFP application in e-procurement. And to go forward with your application or to start an application once an amendment has been posted, you have to accept the amendment. And I'm going to now show you how to do that. So the RFP you're interested in has been amended, and in order to start an application, you need to acknowledge and accept the amendment. You also, if the RFP has not yet been amended, you would just hit this create quote, which is in this actions bar, and then you hit go. This would have you can see there's the warning. It says you have been amended, and then you're going to have to go and view the amendment history, and that will take you to this page. So if you hit view amendment history, you go here, and it's going to help you start the exception and acknowledgement process, which is incredibly lengthy. So here under number 1, there's document number. If you click on that, notice it's in blue. Blue is kind of a theme for e-procurement. You click on blue things and they take you to other documents you screened. You're going to you click on this, the blue here under the document number, that's going to take you to the RFP and to the amendment document. You'll see here under 2, the review changes, this little eyeglass or infinity button. You click on that, that's going to take you to a description of the amendment and then a link to the actual amendment document again. And then when you have done all of the reviewing, you're going to hit the button down on the either upper or lower right-hand side of the screen, acknowledging the amendment, because we want you to acknowledge that, well, let's see, that you have read, you have understood, and that you understand that you're going to be held responsible for everything in the amendment. So step 1, the previous screen, it's really all about actually knowing, opening documents and finding out what we had to say, reading the FAQs. This is where the city starts sort of making sure that you've read this and that you understand that you're going to be held accountable, or you're going to be held accountable for the content of that amendment. So that if we say in the amendment, please, I don't know, we could say something super random, we wouldn't, but say like, please put this in blue font, or please put everything in red font, and then you didn't, and that was contingent, we had said like, we want you to put everything in red font, your application will not be accepted if it's not in red font, and you didn't read the amendment, but you accepted the amendment, and then you came back and said, well, I didn't get a contract because, and we said, well, yeah, you didn't put things in red font, and you said, well, I didn't know that, and we said, well, you clicked through and you said that you knew what was in the amendment, so that's on you. So that's kind of where we're going with this. In this screen, which you would get to after you review the amendment, probably, perhaps make it into a musical, you're going to click this tiny box that says that you accept the terms and conditions of the RFQ and acknowledge the changes made to the RFQ via the amendment document. And then you would acknowledge the amendment in the box on the upper right-hand side. You can see also here in this the middle column here that's under the RFQ and the RFQ number that it says there's a little one sentence. It tells you what the amendment's generally about. In our cases, it's almost always like these is the questions asked in the webinar and the questions that we've also received from people prior. So after you've done that, you're going to go to the screen where you click yes to indicate that you would confirm your acknowledgement of the amendment. So you've acknowledged, and now you're confirming your acknowledgement. Oh, excuse me. And then finally, you're going to click on the terms and, you're going to click on the checkbox that you accept the terms and conditions of the amendment. So you're going to click this tiny checkbox at the bottom of the screen, and then you're going to click on the right-hand side up or down again that you accept the amendment, and there you go. Your life has been perfect. You've accepted the amendment, and you will then be allowed to either continue or start your application. So now here you go. We're kind of going fast forward. You've accepted your amendment. You've done everything you need to do with us in terms of like your application is perfect, and you are ready to submit. And so let me just show you how that's going to happen, and then also you'll understand why I say please give yourself plenty of time to submit. So when you're ready to submit, you're going to start by saving your draft one last time, and then you're going to click continue. When you click continue, the EProcurement system is basically going to scan your application, and it's going to give you, as you can see in this screen, it's going to give you what it perceives to be errors. Sometimes I find that the messaging on how EProcurement tells you what these errors are is a little cryptic. And so we're going to go through 2 very common errors. It will be, one is here we'll say, you must quote on at least one line in the RFQ. So in this particular, for this particular one, the error is, I say here, sometimes, the error message is usually direct to something done in the application. And, you kind of look at the keywords to figure it out. This one, you must quote on at least one line in the RFQ. You look directly below the error, there's this little tab that says lines. In this particular case, we require that you do a cost proposal, which is a downloadable document under the attachment section in the RFQ application. and then you will upload it, and that is what we're going to use to review it, to review your application and your funding, your funding request. The lines is something that's kind of is something that is required when we go to contract, but EProcurement wants you to fill in lines. We're not going to look at the lines to make any funding decision, but you will get this error. You can put in placeholder numbers, you can put in the numbers that you feel are relevant, but we're not going to look at those numbers, so don't spend a lot of time. I would just put in your favorite number, put in your least favorite number, put in whatever, as long as it's not 0, you should make that error. That's how you get that error to go away. And here, in this example, we're going to say, you'll see that the error is a quote value is required for a requirement first name. And in this particular instance, quote value is, as you can see, as I circled down on the right-hand side, the quote value is EProcurement speak for answer. The requirement is EProcurement speak for like application question. And then the first name is the application question first name. You didn't put an answer. So you put in your answer and all is good. So you're gonna basically, once your applicant, you're gonna keep doing that, and then you keep going back and continuing and saving and stuff. And so once your application is free from errors, you're ready to proceed to submit. And at this point, when you click continue, you're not gonna get error messages. It's gonna put your application into the review and submit phase, which you'll know because it says review and submit on the left-hand side there. And so this is the opportunity for you to review. It will basically put your application into one very, very, very long page, which you scroll down and you can review. You see here, there's the printable view. That will allow you to, that will give you a PDF of the application as we see it. And, after you submit, you are not going to be able to access what you said. So unless you have, I highly recommend that you get that printable view and save it so you have a PDF. You can see, exactly what you submitted to us, because the process of submission sucks that away, sucks your application away, gives it to us, and you really don't have access to it, and not to your answers. So here we go. So this is another shot of the long screen that you'll be seeing with all the different answers. And then you'll just keep scrolling down. And at the bottom, you'll be asked to provide an electronic signature. And here's like pro tip. Make sure that you put in your name and title first before you click that like tiny box above the name and title, or else you're going to get an error message. And then you'll just have to do it the way they want you to do it, which is to submit, to put in your name and title first. And then you can see here on the lower left-hand side, there's all these things at the different boxes that you can do. At the end of, it got cut off, but there's a submit button there. So you hit submit, and after you've hit submit, you get a confirmation screen. Now the EProcurement system will send you a confirmation email within 24 hours of your submission. Sometimes it ends up in spam, but if you see that confirmation screen, you know that you have successfully submitted an application. On the other hand, if you are a person who is more anxious than not, please don't hesitate to call or email me if you want me to confirm. The minute you hit submit and the system accepts it is the minute I can see your application, and I'm more than happy to confirm for you that it was received if you are at all nervous about that. So this is about all I have to say about EProcurement. Now is a great time for us to ask some, have you guys ask questions. So about the program, I can see here, there's already 2. One is, and Sean, maybe you can chime in and if you know the answers. I suspect you know the answers. Is this program only available at designated senior centers and community site locations? An awesome question.
Yes, it is only available currently at the 21 senior center and at the designated 19 community site location. And
those are all, the addresses for all of those sites are listed in the
In the
RFP.
RFP, yes.
Here, the other question we have is, the cost proposal will be required after the contract is awarded. So the cost proposal is a document that is in the attachments in the RFP, and it is required that you submit the cost proposal as one of the required attachments to the application. So the cost proposal will be required before the contract is awarded as part of your application to us. And then in terms of how the cost proposal is translated into an actual budget, that happens, during the contract negotiation phase. And by contract negotiation, I mean, like, that's when you come in and you go through your paperwork and you sign the contract, or we tell you, when we get back to you with an award letter, we'll tell you we can help break that out. Is that your understanding, Sean?
Yes, that is correct.
But that is the question there. And those are the two questions that have been posed thus far, but let's see we'll give it a couple minutes to see if there are other questions. Is there an expected number of program hours at each site?
That will sort of get worked out based upon the contracting kind of process after we have a selected respondent, and then based upon what you sort of propose in your cost proposal worksheet, then that would sort of get negotiated, is my understanding, after the respondent is selected.
Oops. Can the cost proposal be an estimate or exact? Well, I believe as part of the cost proposal, you're asked to estimate how many people you're going to serve. And given the years that we've had, I can't imagine anybody really knowing exactly how many
Correct.
would be served. However, there is, as indicated there in the prior screens, there is a finite amount of money. So, do you have additional advice about how applicants should approach the cost proposal in terms of?
I mean, yeah, it's all a proposed. It's a proposed unit rate for each of those core services, and it is, an estimated annual service volume for each of those services. So try to, do your best in trying to figure those numbers out. But obviously, we then would, talk to the select respondent in the contracting phase to sort of further flesh those things out.
I think that it's also important to note that, as indicated in the selection criteria, that while cost and estimates are important, that section is not necessarily as highly weighted as your organization's ability to administer the program from an organizational and a programmatic and administrative point, and to be able to deliver the services. So, if you look at that table in the RFP that with the selection criteria, it has 4 sections, and those are weighted. And so, the questions associated with the RFP in some of those sections will perhaps add up or be more highly, be more important questions than just the cost. Question, what is the in-kind contribution?
contribution. I may not have that information. Oh, sorry. Hello.
Yeah, do you have the rate?
I'm not sure I do at the moment, but that is something definitely I can research and come
So
back to.
in terms of in-kind contribution, what we're generally looking for, or what we mean by in-kind contribution is sort of, we often have a rate like a 10% or 15% rate that we want to see as kind of a match. In-kind contribution can really be anything. It could be that you're donating, you can demonstrate that your organization is subsidizing part of the space that's going to be used, although I guess these are all in centers, so it wouldn't be, but you could, you would basically, or if you have other money that is supplementing salaries for fitness instructors, we understand that most organizations are cobbling together programs out of many funding streams, and that there might be some crossover, and that's where your in-kind contribution is going to come into play. Or those kinds of intersections to demonstrate. Sean?
It does say 10%, Julia.
Oh, great. Thank you.
Yes, can you hear me? It does say 10% in the RFP. Can you hear me?
Yes.
Hello? Oh, yes, it does say 10% in-kind match in the RFP.
And can that be special events?
Can the in-kind match be special events?
Yeah, for special events can the in-kind contribution be a special event? So could the organization host a special event at a senior center and have that count as their in-kind? Good question.
That is a really good question. It sounds like a good idea too. That would be something that I would have to further investigate and sort of get back to if that could be deemed to be. It sounds like a good idea. I'm not 100% sure.
I mean, I think that in the end of it all, potentially it's an allowable cost that, but that you would have to demonstrate that the cost of the special event was not being charged to this particular contract. But yeah, cool. Climbing wall. So let's see if there are any other questions. So I know that we said that that we would have the webinar was going to be from 3 to 4. I don't want to keep people much past that time. I can't. Is there anything you would like to? I'm going to put up the screen that has. Oh, it has my name and Yolanda Curry.
Oh yeah, the last. Yep.
Name. Let's see, Sean. Why don't we're going to add you, just in case.
Sure.
What is your phone number?
742-2615.
So
for programmatic questions, feel free to reach out to Yolanda, and you can copy me as well, and we will get back to you. And then for non-programmatic stuff, you can talk to Julia.
All of this stuff is going to be, all of the questions that were asked here and the questions that we received will be put into an amendment document, which will be posted to the EProcurement RFP. Additionally, as we mentioned, this webinar, a link to this webinar on YouTube if you want to relive the glory moments. It will be available on the DFSS YouTube site, and a copy of the PowerPoint will also be available, and that will be posted to the DFSS website under the alert for this particular, the comprehensive fitness RFP. So if you go click on the comprehensive fitness RFP under the alert section, you will see the links to the webinar, the PowerPoint, and also to the YouTube channel. If that is all the questions that anybody has for today, thank you so much for coming. And thank you for your questions and your attention. And we really are so excited about this opportunity for the seniors of Chicago, and are really looking forward to seeing your applications. John?
Yes, thank you everyone. Thank you for taking your time out of the day to attend, and we look forward to seeing your responses.
Have a wonderful afternoon.